Hi, my name is Dr. Dillon Remmick here with Healthsource Chiropractic in Baxter. And one of the things I wanted to talk to everybody about today was something called sciatica. And you've probably heard of the word before, but I'm going to explain exactly what it is. So just to give you an idea, sciatica is typically burning pain that travels through the backside, all the way down through the leg, many times on the backside of the leg, sometimes to the knee and sometimes past the knee. And if you've ever experienced it or know somebody that has, it's pretty debilitating pain. Right? So we have a lot of solutions that can help with sciatica, but the first thing is it depends on what's leading to it. So I'm going to give you some tips to understand what could be causing these problems. The first thing, as we look at the spine, the first thing that can cause sciatica is sometimes we can have these bones in the spine that shift out of place or twist out of place. When that spine shifts out of place, it can compress the nerve and cause that shooting, burning pain that goes right down the leg. Okay? Because those nerves come from here and they travel right down through the leg. That's one possible cause. Another possible cause is something called a disc bulge or a disc herniation. Okay, and these can be caused anything from trauma to repetitive use and sometimes overuse over time, and this disc can be bulged out and compress on that nerve as well. And the last thing that can cause sciatica problems is muscle-specific problems. And when the muscles compress and they get too tight, what they do is they tend to pinch the nerve as well. So the first thing that we have to do when we work with the patient is we need to evaluate them to find out, is it coming from the alignment, is it coming from the disc, or is it coming from the muscle? And we have a thorough evaluation that we do with patients to determine what's causing that. Let me show you some of the solutions we have based on what's causing it. So if it's a bone that's out of alignment, the first thing we do is adjust the spine. So I'm going to have you lie on this side, face towards me. And we find that bone that we found was out of alignment through an evaluation and many times through x-ray or MRI. And what we do is we take that bone that's out of alignment and we gently push it back into alignment to take pressure off that nerve. Okay, so that's one solution. Another solution is if you're dealing with muscle problems, is we do specific rehab in our office. And so what we do is we focus on specific exercises, stretching, strengthening to help to relax the muscles that are so tight that are compressing the nerve, or to strengthen the muscles that surround those areas so they can make up for some of the problems that are happening. Okay? We have two rehab team members in our office that work one-on-one with our patients to make sure they get the exact rehab that's needed based on their condition. And the last solution we have is for a disc problem. So this patient over here is in our spinal decompression machine. This is the only one that's used in central Minnesota, and it has a huge advantage when it comes to disc problems. So how a disc works, a disc is almost like a sponge. So if you want to look, we have a spine that's here. We have bone, we have disc, we have bone. Sometimes through injury or use, the disc can come compressed. When it comes compressed, what it does is it starts to pinch the nerve. Sometimes that disc bulges out, causes pain. The most important nutrition for a disc is getting movement through there. And if it's not moving, that's what the machine helps with. So what it does is it pulls the disc open and then it allows it to relax. It pulls it open, allows it to relax, which eventually allows that disc to heal, which is a lot safer and better alternative than moving to a back surgery. Okay, typically a back surgery success rate is 26% of people that have low back surgery have the ability to go back to work within 2 years. The decompression machine, many times we see people coming in with a lot of pain, and after one treatment, the pain gets reduced quite dramatically. So to determine if you're a candidate for any of these types of treatments in our office, the smartest thing to do would be to come in for an evaluation to see what is causing your sciatic pain. And then based on that, we can customize a specific game plan for you to get the treatment that you need.